Hello friends, I'm Dr. Bhawna Mittal. Today I would like to discuss with you a very important topic, that is premarital counseling. आज तक इंडिया में बहुत बड़ा ये चलन था कि शादी से पहले लोग कुंडलियां मिलाते थे, हॉरोस्कोप्स मैच करते थे. बहुत स्ट्रिक्टली फैमिलीज में ये फॉलो होता था. अगर हॉरोस्कोप मैच हो रहा है तभी मैरिज होती थी. बट आज के एरा में 2024 में हम लोग एज डॉक्टर्स क्या एडवाइस करेंगे? We would advise that if you're planning to get married, then the couple, the husband and the wife, the future husband and wife, they should visit a doctor, especially a gynecologist, and get a premarital counseling done. It is very important to get your checkup, evaluation, and also some blood tests, that the tests are matching for both of you before you plan to get married. For example, blood group, it's a very important parameter. So if somebody, the lady, is Rh negative and the husband is Rh positive, that is your blood group is positive, then during pregnancy you can have several complications. One way of averting it is that if the lady is Rh negative, she gets married to a Rh negative person, and you can avoid many complications in pregnancy to the baby in the future. Other test is thalassemia test, which is very important, HPLC test. So if one partner is thalassemia minor and unfortunately the second partner also turns out to be thalassemia minor, then the baby in future can have thalassemia major, which is a major blood related problem in which there are several problems to the baby, in which the hemoglobin of the baby does not rise much, and also it can be life threatening and a serious problem in the future for the baby. So if somebody is thalassemia minor, carrier of thalassemia, ideally they should not get married to another person who's also a carrier of thalassemia. Also, sometimes you never know, your partner may be carrying some kind of viral infection like VDRL, HIV, hepatitis B, C. So unless you do the blood test, you will really not be aware that what kind of problems your partner is suffering. Also, a sexual counseling should also be done premaritally. So rather than getting surprises in the future, knowing about the problems later, if you have a basic gynecological checkup, a basic andrological checkup, and the compatibility can be checked before marriage, then in future you can face less marital discord and issues later. Even for the husband, a basic semen analysis test to prove the fertility can be a good idea, rather than knowing of the things in future and then having a discord because of that. So you could get a routine semen analysis done, and similarly for the lady, a basic hormonal profile. So this doesn't mean that if there's a problem then the marriage will not happen, but yes, if there's a problem, at least both of the partners are aware of that problem beforehand, and they know in future what kind of treatment they would have to take, and accordingly they are prepared for it. And if there is some medical issue which is a incompatibility between the two of you, then yes, then based on this medical horoscope, you can defer your marriage or choose a different partner as well. So I think in 2024 we should think a little differently from routine horoscopes, and I would suggest that if you are, or anybody in your family is planning to get married, then one doctor checkup for the couple can go a long way in their future. Thank you for listening to me. If you have any queries, please connect to me. Thank you.